Thank you, Chairperson. The ACDP notes with deep concern the report by the Portfolio Committee on Health on the state of healthcare services in the Eastern Cape. The report by the Portfolio Committee on Health reflects the state of political leadership in our country under the ANC government. The term governance in the Webster Dictionary refers to the authority and direction of an institution under the control of a guardian or public officer. In ancient times, the role of a guardian was to protect and to keep under guard. For the sake of time, I will just reflect on a few issues. The acting CEO of Livingston Hospital states per the report that there was a governance collapse at the hospital. The statement certainly can be applied broadly on the healthcare system of the Eastern Cape. It is devastating to read in a democratic South Africa, pregnant women having to sleep on chairs, a waiting list for C-section, and with a list up to 30 patients daily, resultant in adverse outcomes and increased mortality rates in births. In other words, mothers are going home without a baby in her arms because of poor healthcare. This after she has been subjected to physical discomfort, poor care during labor, and no aftercare support. The death of a child is devastating on women. We cannot make grand statements on GBV without considering the impact of poor healthcare services as portrayed in this report on women in the same way. When you read that at Livingston Hospital, there are severe staff shortages at the ICU, with patients skipping doses of medication and one nurse per 15 patients, that there are no head of a department, read it within the context of a government who committed itself to improve health outcomes for women, who committed to advance the economic empowerment of women, and who prides itself as pro-poor and pro-women. When you read that oncology machines were not working and 100 million rand is needed for repair, consider the fact that every cancer patient is a breadwinner and a contributor to our economy. Consider that every child growing up without a parent faces a higher risk to become vulnerable to social ills. When you read that the committee noted the presence of young girls in the maternity ward, consider that this government undermines the rights of parents through proposed legislations like the Bella Bill and the legalization of prostitution. This government weakens the family structure through lack of intervention and fails its constitutional duty when it comes to service delivery. This report,
Honorable Deputy Minister Mashego, please mute. I'm checking your time. Yeah, I think it has to be 6 seconds.
In 6 seconds, I would state that the government as guardians are responsible for the state of health institutions like Livingston Hospital, Uitenhage Provincial Hospital, Port Elizabeth Hospital, and Dorang Ginza Hospital. And our government cannot decry the state of GBV for women and children, while as a government you are asleep at the wheel. Thank you.
Thank you.